So I'm going to be talking to you about Oxbridge applications, so Oxford and Cambridge. I'm going to start by telling you a bit about the course at Oxbridge and how it differs to other medical schools and why you might want to consider applying here, or perhaps reasons why you might prefer other medical schools. And then I'm going to tell you a bit about the application process and what to expect and how you can prepare for that, which I think even if you're not planning to apply to Oxbridge is definitely applicable to all of your applications. There's a few photos throughout of my college, which is Jesus College, just to showcase some of what we do. So the course is quite traditional at Oxford and Cambridge. It has a preclinical and clinical split. So the first 3 years are completely science-based. So you'll do subjects like biochemistry, anatomy, neuroscience, all of those kind of things, but you'll have quite minimal patient contact in those years. I think for me, I'm in third year and I've probably met about 6 patients so far in my course, which isn't many. But then from fourth year, fifth year, and sixth year, it's all in placement. So you'll just be seeing patients and observing the clinicians. And something that's quite a big focus at Oxbridge is the intercalation year. So that you do that in your third year here, and you get to choose from a really wide range of subjects. So at Oxford, I think, Selena, correct me if I'm wrong, but it's mostly science-based subjects, whereas at Cambridge you can choose from science and other subjects. So I have friends doing languages, law, engineering, things like that. Uh, I'm doing pharmacology, which I'm enjoying quite a lot this year. And another unique thing about Oxbridge is you have lots of small group teaching, which we call supervisions. So there'll probably be about 2 or 3 students in one of these with an academic or a doctor or an older student who's more of an expert in their field, and they'll discuss the stuff you've been doing in lectures and practicals with you so that you can really make sure you have a deep understanding of that. And I think that's a really valuable part of the degree here. I think it's where I've learned a lot of the skills that I hope to take forward, both academically and into the clinic. Another thing linked to Oxbridge is essays, which might not sound very exciting, but they're not too bad. I think they give you a lot of chance to kind of develop your critical thinking and your writing skills, which you might not get so much of at other universities where there's less of a focus on essays. But if that's something that you are definitely sure that you might not enjoy, then it might not be the degree for you. Because I think for my degree this year, it's like 80% essays for my final grade. And it's also very research focused. So we do a lot of practicals, and our lectures are mostly presented from the point of view of the research done behind science concepts. So they're trying to equip you with the skills to go into medical research if that is something that you want to do. So if you're interested in research, which I'm hoping most of you are since you're members of YPAGs and research groups, that can be quite a good thing to consider because you'll get a lot of exposure to that. The course is also very busy, which I'm sure it is at every medical school, and that can be a good thing actually, especially if you love what you're studying because you get to keep studying it. And it's not just busy with the academic work, we also have a lot of social stuff going on at Oxbridge. So we have something called the college system here, where everyone at the university is a member of a specific college. So for me, it's Jesus College, and that's where you live, it's where you eat in hall with your friends, it's where you receive your supervision, so your small group teaching. And then your lectures and practicals will come from the university as a whole. So everyone from all the colleges will go to lectures together and then separate back into their colleges for their supervision teaching. And I think that's a really good system and a really big plus of Oxbridge because it gives you a great community kind of built ready for you to join. For example, here we have all of the years of medics. We run lots of events together, so you always have people that you can ask advice for, people that you can ask about lectures if you don't understand, which is quite handy, especially at the start of university. Another thing is it's a bit of a cliche, but I think it is quite true that everyone's really inspired about what they're learning here and really excited about it, which means you do get lots of great conversations about what people are studying, and that can really help you get a more like wide-ranging understanding of different topics. And I think that's definitely useful going forward to being a doctor. We also have lots of fun things to do in Cambridge, and I'm sure there are in Oxford as well. The cities are really beautiful. So we have a photo of punting here, and the river with rowing is quite a big thing. But we have lots of sports societies. So I do swimming, which is the top left photo. And then the bottom left is all of the Jesus medics and vets. We have like an annual dinner together, which is really nice. And you get to meet kind of the alumni and medics from older years, which is great. And there's also lots of music opportunities, and really there's anything you could think of. So going forward to think about your applications, I think there's probably three or four main things to focus on. So the first one is supercurriculars. Supercurriculars are, if you think about extracurriculars, so sport and music, they're similar to that, but they're academic focus rather than other topics. So they'll be kind of, if you think about your school curriculum, you choose a topic, but you go beyond that. So beyond what you've been learning, you decide to look at something new. And it just shows that you're motivated to study your subject and that you're actually interested in it and you have initiative, which is what they want to see in the application because there is a lot of science here in the degree, so they want to know that you're definitely interested in that. And I think it is one of the most important parts because you'll need to mention it in your personal statement, or well, it's not called the personal statement anymore, but your kind of writing that you send to the universities, and they'll also probably bring it up in your interviews. So I've given a quick example here of taking things that you've learned a little bit further. So, for example, you might attend a YPAG session and you might learn about an interesting treatment being researched for a disease, and you think, oh, that's really cool. I want to know some more about that. And then afterwards, you might go and research a little bit more about what current treatments there are, what patients who have that disease experience. And then you can reflect on that a little bit further. So, what have I learnt from that which I can apply as a medical student or a future doctor? And I think that reflection, so thinking about not just what have I literally read and written down about this disease, but what have I now learnt from that which I can take forward is the most important thing. And I've got a few more examples on this slide of different supercurriculars which you could try. I think these are something you can start doing from any point when you're interested in medicine. So even if you're not applying yet, if you're still maybe doing GCSEs or just thinking about medicine, you could definitely give some of these a go. So there's various competitions you can join. I think for me, my sixth form runs like they encourage people to join these anyway, so your schools might also do that. And if they don't, then why not ask your teacher about them? Because I think they're quite fun, they're interesting, and they're just something that you can mention that you did and enjoyed. So a few that I found is the UK Brain Bee, which is neuroscience based. I think the registration is later next year, but maybe double check. And then there's also chemistry challenges, biology challenges, which they're usually just like an hour test, multiple choice, like quiz, kind of fun applications of what you do in school rather than a GCSE style exam, for example. You could also try essay competitions. Essay competitions are a bit intimidating, I think, but it really doesn't matter how you do. I think the main point is having a go, and then you can talk about what you learned and what skills you learned from writing that essay that you can take forward and what you enjoyed. So I've just linked one example that I found online that you might want to think about having a go at. And there's also loads of talks online, YouTube videos, courses, which you can do for something you find interesting. So, for example, I think I did a course on Open Learn about cardiovascular diseases, which was quite interesting, and then something that I could talk about in my interviews. And then, of course, YPAG and the other research groups that you're part of are great super curriculars. And you can think about taking this a little bit further, like we said, so developing a particular interest that you might have. But just to reiterate, I think the most important thing is not just listing things you've done down and ticking them off, but also reflecting on what you've learned throughout that process. So, did you understand a bit more about the clinical trial process that drugs go through, and that's given you a better understanding of prescribing and research, or have you discovered a few skills that you think you might need to develop in order to be a better doctor, things like that. And then for the interviews, I'm sure we're going to hear a lot more about interviews later, but for the Oxbridge interviews, they have quite a different style. So they are panel interviews, so you usually have 2 to 4 academics talking to you at once for about 20 minutes per interview, and they have quite an academic focus. So they'll generally be based on your A-level content, but then they'll take that forwards into a more unfamiliar situation, which sounds daunting again, but it's more of a conversation than an interview compared to some of the other universities, is what I found. So they'll talk to you about a new topic and then ask you some questions. And if you start maybe going down the wrong route or need some help, they'll give you some hints, and it's more of a like a teaching session kind of style. And it slightly mimics a supervision, so that small group teaching that I was mentioning. I mean, a supervision isn't as intimidating as an interview, but it's it's a similar kind of layout. And they're really looking to see how you think and how you can approach an unfamiliar situation rather than can you get to this exact answer. So, thinking about preparing for the interviews, I think key thing to do is to revise your A-level content, especially biology and chemistry, because most of the questions will build on that content. And review your personal statement as well, because they might ask you about those super curriculars that you've done or any work experience that you mentioned. And it's good to be prepared. You don't want to not remember what you did just because you didn't read your notes again before the interview. And I would say practice interviews with whoever you can. They don't have to be applying for medicine or know about science. It's just important to get comfortable with being uncomfortable. So when you get thrown into an unfamiliar situation, you don't panic and you think logically, how can I approach this? And also just practice saying your thoughts out loud. It sounds kind of strange, but we don't normally talk about science. We tend to write it down in exams or in our homework. We don't say the words out loud that much. So it's good to practice that. And also just developing your enthusiasm by talking about the subject can be really helpful. I would also say make sure that you say your thoughts out loud during the interview. I think that's the most important thing that you can do. So they see what you're thinking and it doesn't rely on you getting to the right answer. They want to know, how are you approaching the problem? Can you think of different approaches if one doesn't work and things like that? And then finally, try and enjoy the experience. I think this applies to all your interviews. I know that they're really stressful and not the most enjoyable thing, but if you smile and treat it like a conversation, I think it will definitely come across that you're more kind of confident and you're enjoying the process, I think that would be a really positive thing for the interviewers.
Perfect. Thank you, Hannah. We've got one question in the chat, so I will shout it out and hopefully you can give us an answer. So the question was, is it easy to lose motivation or get bored easily during the first 3 years of Oxbridge, especially since there's no sort of hospital placement or patient contact?
I would say that depends on if you also have quite a strong interest in the science and the research behind medicine. So if you're going into medicine and you know, I just really want to see patients, I just want to be in the hospitals talking to people, then you might lose motivation. But if you have an interest in the science and research, I don't think so because it is genuinely so interesting, what we're studying. And we have in first and second year you go to the hospital like twice a year, so you have a little bit of patient contact to keep you motivated. But I think yeah, it's definitely something to think about whether you will enjoy the research and the science-based learning in the first 3 years.
Cool. I think we've just had another question in, so thank you for that one. So the question is, how do you recommend finding a specific research interest in a particular part of medicine, e.g., for undertaking independent research project or EPQ?
That's a good question. I think you kind of just have to start looking at things. So if you maybe go to a few YPAG meetings, you might come across something that you find, oh, that's quite interesting. Maybe I'll look into it a bit more. And sometimes you might find, oh, that's not as interesting as I first thought. That's fine. Um, then maybe look at something else. Or you could try watching YouTube videos, documentaries, anything that just exposes you to different areas of medicine is quite good because the more you see, the more chance that you'll find something that you find interesting. But I also think it's important to remember that even if you haven't found that one thing that you're really like passionate about and interested in, that's fine. A lot of people don't know what they're really interested in at this point or even like throughout medical school. So just giving different things a go, you don't really have anything to lose from researching something for maybe like watching a 20-minute video on it and then deciding if that interests you or not. So just have a look at different things would be my advice.
Yeah, I'd fully agree with that one. I'd say just like find things that you think are cool and do a bit of reading on them. And then if you think there's like something you can work with, try working with it and kind of see where that goes. I think don't force yourself to do things that you think you should be doing. Do the things that like genuinely spark a bit of interest and that you think you can see this through to the end. We don't have any more questions at the moment, but we do have a couple more minutes. So I think I had one, and mine was, what's your favorite sort of part about university and Oxbridge in particular?
Oh, that's a difficult question. Um, I would say the community, to be honest.
Yeah.
I think we have like such an amazing group of medics and vets here at Cambridge. It's so inspiring to see what everyone's been learning about and hearing everyone talk so passionately about what they're studying. And it's also great that you can bounce ideas off each other. If you've had maybe an interesting lecture, you can talk about that. And it's just a really inspiring community to be in.
Amazing. Thank you. I know you've got to head off, so if we don't have any more questions, I think we'll probably be good to stop there, unless anyone's got any last minute questions to share. No, okay. I think we'll leave that for now. So thank you for that. That was really good.